If I'm hiring someone for any role, the one thing I want to see is progression of roles, and usually progression of a couple of roles in the same organization. I look for someone who's had success in various roles, and I'm willing, if that is the type of person I see, and they don't have complete experience in the role I'm looking to fill, but I believe they have the potential and they've been successful in their role before, I will take a chance and be willing to coach them into the next role.
Hey everyone, and welcome to another episode of the CEO podcast. My name is Mario, together with my partner and co-host Robert, where we talk all things CEO. Today's guest is Dr. David Berger. David is a current CEO of Suny Downstate Medical Center. He's also a coach, a leader. He's very passionate about digitalizing healthcare and AI, and we will discuss all of the things. David, welcome to the podcast, sir.
Thank you so much for having me. Great to see you again, Robert and Mario.
No problem.
At the risk of reiterating, you are the CEO of the Suny Downstate Medical Center. You're a coach who leads turnarounds for other medical centers. And most importantly, you're a real leader on a bigger stage with a passion for transforming the future of healthcare. Now, there's two questions I have to ask you. One is, I think there was an old movie or play entitled What Makes Sammy Run? Which means, what are your motivations and aspirations in doing this?
I don't know who Sammy is. I never saw that movie.
I didn't see it either, but my mother used to quote it all the time.
My personal and professional mission is pretty simple. And that's essentially, I want to make healthcare simple for everyone. Obviously, I'm someone who has complete access to anything I want within the healthcare system. If my kids need something, I can access it. My mom needs something, I can access it. It's easy for me. And this goes back a few years ago when my mom had some really significant health issues and she was in the hospital. She had 4 operations. If I wasn't there or my wife wasn't there 24/7, it's hard to believe she would have gotten through what happened successfully. And the reasons that she got through, not just because I was there, but I was able to choose her physicians. I was able to access tests and medications and things that other people couldn't or would have delays in getting. And that's why she was able to get through this health crisis. Being someone who now is responsible for helping get care delivered to others, I want everyone to be able to have that same kind of experience and to be able to maintain their health, as well as when they do have a crisis, being able to deal with the health system in a simple and easy manner. So that's my personal and professional mission.
That was a very noble aspiration, a noble winning aspiration. I read a book a few years ago on strategy, and the author of the book said, strategy is not the goal, strategy is how. So what is your strategy for achieving this mission of simplifying healthcare for everyone, which I think is, absolutely brilliant?
So I think there's 2 strategies. One is related to my day job, which is running a hospital. The other is related to my passion, which is advancing digital health. So let's talk first about strategy in running a healthcare system or a hospital. Yeah. So, and this goes back to John Kotter, culture eats strategy for lunch. So it's really about culture and building a culture. So I took over an institution with a very damaged culture. University Hospital at Downstate had just come out of the first wave of the pandemic. It was a COVID-only hospital. A number of providers that worked in the hospital also succumbed to COVID during this first wave. It was a major issue within central Brooklyn in our community, which was devastated by the COVID pandemic. And in fact, University Hospital Downstate was designated by the governor of New York a COVID only institution for almost 4 months, which means everything else had to be transferred out. And a lot of our private physicians left and went to other hospitals. Our kidney transplant program was suspended. Our open heart program was suspended. So, really, COVID only. And then once the first wave of COVID passed in New York, and we were left without patients to take care of because all these physicians and doctors had left downstate and would start to build their practices elsewhere and work elsewhere. So that was one thing. Secondly, two of our major programs, as I mentioned, were on hold because of poor quality. Third, we were financially devastated by the pandemic. We lost over $250 million. A really difficult situation. So walking into a difficult situation, how do you move forward? And again, I go back to the issue of building culture. And how do you build culture in a healthcare institution? It's focusing on quality and patient safety. So at that time, we decided to embark on what is called a high reliability journey. And we did that with an organization, Press-Ganey, and we've been at that now for almost 3 years. And that's had a significant impact on how we deliver care. Are we currently highly reliable? Is healthcare simple for everyone in our institution? Not yet, but we're on the journey. Now, my hobby or my non-day job in terms of digital health and artificial intelligence is I believe digital health and artificial intelligence is going to change how we deliver healthcare. And I believe it's going to democratize eventually healthcare and improve access and potentially reduce disparities. So, how I see my strategy in that ecosystem is helping identify one, companies that are going to be successful and bringing them into my institution. Two is helping companies that I think are going to be successful by teaching them how to interact with the healthcare system.
Could you explain what you mean by that?
So, companies meaning people who are starting businesses that have digital health solutions that are designed to help the different parts of healthcare function better. So, I divide up the potential solutions into basically 4 parts of what I do and how hospitals deliver care. So, there's the back end, which is things like coding and billing and revenue cycle and all those kind of activities. Then there's the front end, which is scheduling, providing access, those kind of issues that hospitals deal with. And then there's actual delivery of patient care. And I divide that up into 2 different aspects. The first one is the operations of delivering care. So how you schedule appointments, how you schedule radiology testing. What radiology testing do you do? How do you prioritize who's going to get tested? And then the other part of it is actually the delivery of care. So how we make the diagnosis, how we read x-rays, how we read pathology, how we dictate and in the chart how clinicians make decisions about who's going to get what treatment. So that's the different aspects of what we do in the hospital. And there are companies that focus on within those 4 aspects of healthcare delivery, they have specific solutions.
David, if you could maybe take yourself out of the let's say the medical content and just look at the CEO position on itself, what would you say are 2 or 3 things that only a CEO can do, right? From your experience.
That only you can do versus your team.
Right. So the only thing that the CEO can do versus can easily delegate.
Wow. So I think what I can do that a lot of other people can't do is remove the barriers that exist for the senior most people, right? So there comes a point in the C-suite and the chief operating officer, chief financial officer, et cetera, they're going to have barriers. the one thing I can do that they can't do is help them identify the barriers and go to the level that the barrier needs to be removed and help remove that barrier. The other thing they can't do, they can't see and touch everything in the organization like I can. So I have, because of the fact that not everyone else has total responsibility for the organization, they don't know everything going on in every part of my organization. So I have the ability to see the big picture that they may not have. And then the third thing I would say I have the ability to do that they may not have the ability to do is coach others to become CEO.
Ah.
Right? So my job is to help people get to the level and to accomplish what they want to in their professional lives. If they want to be a CEO, there's no one else in the organization that can do that besides me.
Very interesting. You mentioned CEO and chief financial and so on, chief medical, right? So, what would be your advice on?
So if I'm hiring someone for any role, the one thing I want to see is progression of roles, and usually progression of a couple of roles in the same organization.
Why is that?
Why? Is because who knows someone the best? It's the
Oh,
people who work with that person. So, for example, I was at Baylor St. Luke's. First, I was the chief medical officer. Then I was the chief clinical officer. Then I was the chief operating officer. And why did I get promoted? Because I was successful in the previous role. So, and I do this myself. If I need something done and I want someone in my organization to do it, I'll ask someone I know who's done it before and is successful and can potentially grow and take on the next role. So I'm now the president of my synagogue. How did I become the president of my synagogue? Because they saw a busy person who's been successful in multiple roles, and that's why they asked me to do it. I've only been here for a couple of years; they don't know me real well, but that's what they see, and that's what I see. I look for someone who's had success in various roles, and I'm willing, if that is the type of person I see, and they don't have complete experience in the role I'm looking to fill, but I believe they have the potential and they've been successful in their role before, I will take a chance and be willing to coach them into the next role. So my CMO that just left the organization for a promotion, she had never been a CMO before, but she had done an amazing job as a medical director within a real interesting part of my organization. And based on that fact and the fact that she had done multiple things successfully, I promoted her into CMO, and then I took responsibility on myself to coach her as a CMO until the point where she was able to take on that role and completely assume it herself with very little supervision.
did you say that you pay attention to people who've made a progression in the same organization or any organization?
Yeah, so I usually like to see people at least one or two progression in one or two levels within the same
That's a very
organization. Certainly people do move around, but if people are moving around every time just to be promoted, I look at that a little bit
oh, that's a great
suspiciously.
insight. That's a great insight. Have you ever heard of a guy named Sidney Finkelstein?
No, I haven't.
He's a professor at Dartmouth Tuck School of Business, and he wrote a book called Super Bosses. And he said something that reminded me of what you said. He said that the best CEOs are people who build master apprentice relationships with other people in their organization. This is something that you said that I don't think many CEOs really think about. When they have
Yeah,
to hire someone, they call Russell Reynolds. Go ahead.
yeah. So I agree with that 100%. And my first instinct when someone does leave at a management or senior management level is to see if I can identify someone within my organization that can be promoted into that role. I think it motivates people in the organization when they see that you're hiring and promoting people from within. So you're invested in your workforce, right? And then occasionally you do have to go outside the organization if there isn't the talent. And also sometimes you go outside the organization just to bring in a fresh set of eyes. But I think it's really important to try to grow people within your organization and to promote from within your organization.
I had one other follow-up question. I'm sure you've heard of the legendary CEO, Jack Welch, whose reputation has risen and fallen, risen. But he had a process that might be interesting for you in terms of simplifying healthcare delivery in your organization. It was called the workout process. And every week he would visit a different GE division or location or department, and he would get people to talk to him about what's working and what's not working. And then he had the power to instantly make a decision about whether to change the process or change the goal or change the outcome. So in most cases, the problems were bureaucratic rigmarole or broken processes. So I thought that might be an interesting approach.
Yeah, so we do that. I go to every department I have. I do what I call bagels with Berger,
Oh,
where I bring breakfast to the group and just talk about what's going on, what's working, what's not working. And we have things we call just do it's versus things that require real process improvement. And the bureaucratic stuff that you're talking about, Jack Welch approached in that way, are what we call our just do it's. So those are things that you don't need put a committee together. You don't need Six Sigma methodology. Those things need to be fixed immediately. So those are the just do it's.
that's great. That's great.
David, I do find it fascinating because when Robert and I talk with different CEOs, not a lot of them take it upon themselves to coach their executive team, right? So if you look through your upbringing and your education and growing into this role, who were your role models? Who were the people that you look up to? And if you could maybe recommend for our listeners, what are 2 or 3 books that every CEO should read?
So I'll start with the books. My favorite book on leadership is A Team of Rivals. I'm a big Lincoln and Civil War buff. It's a book about Lincoln and his cabinet, and it talks about most of the people that were in his cabinet, his Secretary of State, his Secretary of War, et cetera, were running against him to be president in 1860. And basically, they thought Lincoln was a country bumpkin. And as you read it, and as his administration progresses, you realize how these people came to love and respect him. And he won them over not by force. He won them over through his will, through his humor, through his communication. So that's probably my favorite book about leadership. And it's not really a leadership book. It's more a story of how Lincoln dealt with
So
these people.
for all the listeners, we will put an Amazon link to the book in the comments so you can check out.
David, when you told that story about part of your mission came out of the empathy that you felt for other people having gone through some difficulties with your mother's healthcare situation. You imagine what it must be like for other people that didn't have the access to healthcare that you had. I mentioned to you in a previous conversation that reminded me of FDR. Now you're reminding me a little bit, I hate to say it, of Lincoln. Because Lincoln is someone he didn't just have a good sense of humor and tell funny stories. He had great empathy. He told someone, if you like slavery so much, why don't you try it yourself? So I wanted to come back to this point because it's very easy to talk about the person's role. FDR, Lincoln, Washington were great presidents, but it was something about their personality that actually made them, or their character that made them a great leader. And as I'm speaking with you, I'm saying when David shows up in the office, he just doesn't go sit behind a big desk that says CEO. He's David. So I wonder how people get you. I wonder how you show up for people. People must see that you have a greater purpose, that you have a sense of humor, that you're empathetic, that you take responsibility, that you treat everyone as a colleague. Maybe this is a hard question for you to answer, but I think who you are is integral to your effectiveness as a CEO. And any comment on that?
Well, you're going to give me a swelled head when you start comparing me to Washington,
Well,
Lincoln, and
only in the dimension of
Roosevelt.
empathy. Okay. Yeah, well, they weren't Jewish. That you bring something to the table they didn't have.
Yeah. And I don't know if you've ever met a president or a past president. And I had the privilege of meeting Bush Sr., and those people are incredible human beings, and their ability to relate to others is really what gets them to the pinnacle of leadership, which is President of the United States. I am by nature, and you're probably going to be a little surprised because I work on this a lot, I am an introvert. I would much rather talk to someone one on one. I hate walking into a big crowded room with a lot of people that I don't know and then have to go network. So I am by nature an introvert. So it does take me a little while to warm up and for people to warm up to me. It's something I know about me and it's something I work on constantly. But I think as people come to know me and see how I function and how I treat others as well as treat them, the things that you mentioned in terms of empathy come out. And I know that's what I've had 360s done. And that consistently comes out that I care about people. And going back to the issue of successful CEOs, if you don't care about people and you're not invested in how to develop your people, you're not going to be successful as a leader. And the people who work with you and for you will quickly see that you're not really invested in them and that it's about you, and that becomes a problem.
Mario?
Especially, I would say the more people you should be leading. So if you're a little bit higher on the hierarchy, if you're a part of a C-suite, that shows up, and just doing your work will not get you there. You do need other people, and happiness is other people, as they say in the Good Place TV show. So let's just a tiny thought experiment. Let's say we meet again, you, me, and Robert, 3 years in the future. What's happened with healthcare and the digital revolution and AI 3 years from now?
For you to be happy with your progress.
Yes.
So I believe we will make progress in 3 years. I believe things will be significantly better. I am an optimist. I believe one of the biggest issues in healthcare and one of the biggest reasons for burnout amongst healthcare providers is how they deal with the electronic health record and how much time they have to spend dictating and interacting with the electronic health record. For a primary care person, it's currently almost 45% of their time is just dealing with the electronic health care record. I sincerely believe that issue will be largely solved. I'm very optimistic about one specific digital artificial intelligence tool, and that's ambient dictation, whereby instead of a doctor having to sit at a computer typing what they're being told by a patient, they can have an interactive conversation that is taken in by the artificial intelligence, and an accurate note is crafted specifically from that. I believe we will be there in 3 years. I believe that will have a significant impact on how providers deal with patients. I believe we will become more patient-centered because of that and potentially reduce the level of burnout we're currently seeing. Will healthcare be perfect for everyone? Hard to believe that's going to happen in 3 years. I think this healthcare moves a lot slower than most other industries. I think real foundational change is going to take probably 10 years. But regardless of how much we do in digital health, how much we try to improve things within single healthcare entities, hospitals, etc., until the United States changes the way we pay for healthcare, we're not going to fundamentally and totally transform how we
Could
deliver
you say
healthcare.
more on what you mean by that?
Yeah, so now you have basically, despite 15 years of intensive value based payments, meaning paying for quality, overwhelmingly, the way healthcare is paid for is on a fee for service basis. You're paying for a widget, and the more widgets you produce, the more money you make. And about 50 or 60% of the people in this country have some form of private insurance, while the rest have some form of government insurance, either Medicaid, Medicare, potentially also VA insurance. Medicare and Medicaid do not adequately cover the cost of care, and there's currently cost shifting from hospitals to commercial insurers who pay for a significantly more part of care. So if you're a hospital and you have a huge percentage of private insurance, you make more money and you make a margin. If you are principally government, you don't make a margin and you don't have any money and you can't invest it in facilities, you can't invest it in equipment. So we have a very disparate healthcare system. We have to think about how we can better align quality and alleviate disparities and try to achieve some kind of healthcare equity while also changing how we pay for that specific healthcare, because the system produces what it's incentivized to produce. And currently it's incentivized to produce significant disparities within the system.
Just a couple of more questions. I know you're a busy guy. When you play the role of a masterful coach and helping other healthcare CEOs or leaders transform their organization, what is your approach to coaching them? And also, what is your approach to coaching people in these master apprentice relationships that you might build?
Yeah, so we'll talk about the second first. So, in terms of coaching my people, the first thing we always do is what are your goals and what are your responsibilities? How are you going to go about doing it? And then my job is really to help them overcome the barriers to be successful, as well as make sure they're accountable for the things that they say they're going to be accountable for. Pretty straightforward. Coaching others outside of my organization, it's really trying to get them to think through what their challenges are. I never try to give them an answer. I try to repeat back to them what their problem is, and then we think through what the options are to deal with that problem. So it's sort of like psychiatry.
That's a great.
You're not solving anyone's problem. You're getting them to understand what their problem is,
Yes.
and help them to solve what their problem is.
I said to someone the other day, unless you're standing inside the person's shoes, seeing the world with their eyes, the line between giving good advice and bad advice is very thin. You're not in their situation, and I think that's a great way to approach coaching.
And,
Mario?
and one other point with that before Mario, you ask another question, is you also need to help them understand the other part of the conflict, because most of the coaching is trying to resolve conflict, right? So there's always 2 points to a conflict and the truth is somewhere in the middle. And when you're coaching someone, they're just seeing their point of the conflict or the problem. You need to also help them expand their vision so that they see what the other potential parts of the problem they're dealing with are.
Spot on.
Yeah. Last question from my side, David, and thank you so much for being here with us. Thank you for sharing wisdom. to all of our listeners. The last question from my side is, what advice would you give to a newly instated CEO, and what he or she needs to do and accomplish, and how he or she needs to be in, let's say, the first 100 days of their mandate or of their tenure? Right.
So, a couple of things. First thing is spend time listening. And not just listening to the people who report to you, try to meet with people throughout the organization and get a sense of the organization and the culture. You have to understand the people and the culture. First thing. Second thing is develop relationships with the people you are directly working with, either your direct reports, the people you report to, as well as, and especially people who don't report to you, but you have relationships with and you overlap with. Usually, as a CEO, you're going to have a board. So it's important to establish personal relationships with the members of the board and understand where they are and how they can help you and what is their vision of the organization. Those are critical to develop those relationships. And then to try to make sure you're developing credibility within the organization, you have to knock out one or two relatively low-hanging problems that show the organization you're capable of getting things done and moving things forward.
Cool. Robert, any last questions for David?
That's not a question, it's a statement. I think David has really delivered here. You've said a lot of great things.
So, David, thank you so much for joining us today. Thank you for sharing your wisdom and your experience, especially with CEOs that are just getting into the role. Thank you so much for being here. It was a genuine pleasure having you.
Actually, it was my pleasure. It was a lot of fun. Thank you so much for having me.